So you've been told you have sciatica and you're still in pain. Hey, you're not alone. The goal of today's episode is to cover what exactly is sciatica, what causes it, and what you can do at home. Yes, home therapy to combat sciatica.
Welcome to the Defeating Pain Podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
So you've been diagnosed with sciatica. What does that mean? It means that the largest nerve in your body, the sciatic nerve, is angry. You've probably tried ice, some pain meds, stretches, probably chiropractic care, maybe early on, physical therapy, but that nerve just keeps firing. Why? Because the standard treatment many times fail to get that nerve under control because we have to find out what exactly is compressing that nerve. What's causing the sciatic nerve just to go haywire and be really angry? It creates nerve inflammation and that misfiring, it just ramps things up and it keeps going into the spinal cord and up to the brain where you perceive the pain. So until you address number one, where that nerve is being compressed or what's pressing up against that nerve and what's causing the inflammation, you're just going to keep chasing the symptoms. So let's get some things clear. The sciatica, it's not a diagnosis, it's a symptom. Now, if people may say, hey, I was diagnosed with sciatica, but sciatica really means that the largest nerve in your body, again, is angry and it's creating pain going down the back part of your legs, many times all the way to the calf. Now, I sometimes get patients that come in and go, yeah, my sciatica is hurting again. And they point to the front of their leg, or they say, yeah, I got sciatica, and they're pointing to the side of their leg. That's not sciatica. Sciatica is down the back part of your leg, starts in your butt, goes down in the middle part, like your hamstring, breaks off in two about the knee, and goes down into the foot. So when the sciatic nerve is compressed, it can become inflamed, it becomes irritated. That compression occurs either from a disc that is migrated against one of the nerve roots that form the sciatic nerve. It can be from the piriformis muscle, which the sciatic nerve comes right through if that piriformis gets fasting or hypertonic because you lead a sedentary life, because you sit a lot, it will compress the sciatic nerve. So if your care plan doesn't target the nerve directly, you won't get relief. So let's talk about this sciatic nerve's journey. Again, it's the largest nerve in your body. It starts in the lower spine and it runs through the butt and to the leg. And when irritated, it can cause sharp pain. It can cause tingling and weakness. Sometimes I've even had patients state that it felt like a blowtorch was right on their butt and going down the back part of their leg. Why traditional care often failed? Ice. Superficial. It's not going to get deep down in to where that sciatic nerve really needs to be felt. Pain meds, they can mask the signal. So I'm not against pain meds with sciatic because short term it can help. Stretching, definitely. There is a test. It's called straight leg raise, and it sounds just like it is. You're laying on your back. The doctor or the therapist keeps your legs straight and they raise it up, and that stretches out the nerve. And that probably is not going to feel really good. It actually is a test to see if there is a disc problem creating sciatica. I think the better approach is you've got to do things at home. You've got to get some kind of therapy that you can place multiple times a day on that nerve. There's always two areas that the nerve is really irritated. And what I recommend and what we use quite often in the clinic. So if we have first of all, if we have somebody that comes in with sciatic, after we've done a complete thorough examination on them, and what we're going to find is that the hamstrings typically are weak, the glutes are going to be weak, and anything I do with keeping the leg straight is going to irritate that leg. If they try to do a toe touch, going to irritate the leg. If they are seated and they raise their legs up, it's going to cause problems. So what I need to do is I got to get patients out of pain right away. We're going to put them on the Biowave and we're going to put the pads on the two areas that are the most painful. You can do that at home and you can do it multiple times during the day. You just take an hour off in between each treatment and then put the Biowave Go on for 30 minutes. Now, what we need to do is we just need to calm things down and get you out of pain right away. The reason it's so much better than a TENS unit is that the TENS unit stands for transcutaneous electrical nerve stimulation. Transcutaneous, big word. What does that mean? It means that it just barely gets underneath the skin. But anyway, the TENS unit just can't penetrate that deep down. Biowave Go can. What it does is it sets up a buffer, it sets up a force field. And so the pain transmissions coming from the sciatic nerve trying to make it back up into your spinal cord are being blocked, which is good. So this will allow you to, number one, sleep better because sciatica suffers. And if you're one, you can raise your hand. Hey, better yet, just comment right now. Comment, say, yes, this is true. What Dr. Arkfeld is saying is absolutely true, that you don't sleep well. That leg feels like it's on fire and you're not comfortable. You got to get up and keep moving around. So what's going to happen is that you hit that sciatic nerve with the Biowave Go. It's going to allow you to sleep better. We repair when we're sleeping better. Okay. So then we can start getting into doing more movement with the Biowave Go. Once we get that pain level down below a 5 and it's not constant anymore, then we are going to start to move into ARP neurological therapy. ARP neurological therapy is going to address the muscular problem that is probably responsible for the causation of this whole sciatic adventure. So let's take a disc. We've got a herniated disc causing sciatica. See, what nobody ever talks about is what caused the herniated disc. Now, you'll go to your MD, you'll go to the neurologist, orthopedic specialist, pain management, and they'll say, you've got a herniated disc. You did something. You've been lifting things and twisting. It's been repeated trauma. Finally, that disc just got tired and the outer part broke away, or the outer part created a little fissure and the inner part started to migrate out and it's butting up against one of the nerve roots that forms the sciatic nerve. This is why laser therapy and spinal decompression, even though they will get you out of pain, they do not address the causation of the pain. And so a disc problem will come back if you use just those two therapies. What you need to do, you've got to address the muscular issue that has occurred. And the muscular issue is in the form of a muscle we call the multifidus muscle. It is the deepest muscle. It attaches to the spine. It is a spinal stabilizer. That means it prevents your individual vertebrae from shifting and moving. Why is that important? Because when that individual vertebrae, they start shifting and start moving, little shear forces going on. Where's the forces acting on? The disc. And the disc has this outer layer that's full of nerves. And then the inner part, the nucleus. So when that outer layer starts to get irritated and it can become frayed and you get these little cracks, then the inner part starts migrating out. If that nucleus migrates out enough and the annular fibers, which are the outer part, those annular fibers start bulging out, they will butt up against the very delicate nerve tissue, the nerve roots. And those nerve roots, they're like tributaries in a river. They form, they come together, and then they form into the sciatic nerve. So it creates a decrease in that nerve flow. So what happens also is, see, you've got a vascular supply. Nerves need vascular supply for them to function properly too. And when there's any compression on the nerve, there's going to be compression on the vascular supply. So what we got to do is we've got to get the multifidus muscle to do its job. And the only way you can do that is by using art neurological therapy. It's the only neurological stimulation that gets deep down in, and we're going to go at 500 pulses per second. So the muscle is weak. We're hitting it with 500 pulses per second, and it's doing eccentric contractions. What does that mean? The best way that I think about it is these little guys down at the muscle, and they're down there just stretching the muscle out. But that's also working the muscle. And that muscle gets brought back online and it becomes strong and it keeps your spine stabilized. The other important part of the multifidus muscle is that it sends signals directly up to your brain to a portion of the brain called the cerebellum. The cerebellum is responsible for coordination, posture, movement, and a lot of other things too. So typically when somebody comes in to see me and they have a low back problem, like a disc problem, and they've got sciatica, typically they're going to have coordination issues. They're going to have balance issues. And obviously they're going to have restricted movement. So for you really intelligent ones out there, you're probably going, Dr. Arkfeld, if the multifidus muscle is deep, deep down, how the heck can you palpate it when performing your myofascial or spinal palpation evaluation? Very good question. I can't palpate the multifidus. So you're probably thinking, then how do I know it's not working? I know it's not working because the muscle immediately above it, or what we call the superficial muscles, are really tight. They're like very hypertonic, spastic. When those muscles are like that, then I know that they are trying to pick up the slack for the multifidus muscle. So that's how I know the multifidus isn't working. I also know because the patient presents with disc symptoms and sciatica. So what we need to do is, again, we've got to get the multifidus muscle turned back on. We do have to get pressure off that disc and off the nerve. Now, you don't have to pay thousands of dollars for spinal decompression. I have a really good traction table at the clinic that will do the same thing as spinal decompression. Now, I know there's going to be chiropractors out there that hear this, that are using it, and they're going to go, no. I can tell you that in 37 years of practice, of which 3 of those were in a chronic pain clinic where all I saw were disc problems, and we had the fancy spinal decompression tables. And finally, I just said, I don't want to use them anymore. The table that I used was called Cox Flexion Distraction Table, which did create a decompression. And now I use a Cox table. I still use that, but I also use a Hill mechanical traction table. All I'm trying to do is separate the vertebrae. I'm just trying to get pressure off that disc. When I do that, when you do traction, see, the end result is spinal decompression. You're decompressing the disc. You're getting the irritated disc tissue. We're backing it off with pressure. The other problem is that, again, if the multifidus muscle is never addressed, once you get done with your decompression therapy, see, gravity comes in. We are always fighting gravity. And after a while, the same thing's going to happen. The multifidus is going to be weak. Gravity is going to take its effect, and you're going to be right back. That's why passive therapies of laser and spinal decompression just isn't enough. You've got to include active rehabilitation. You've got to rehab and strengthen the muscles. Now, the other thing you have to do is increase the flexibility of a patient. Now, you can't start the stretching right away when they have the sciatica. It's just too painful. We need to start doing stretches on the hip joint. We have to then slowly, once the leg pain is gone, start doing stretches on the quad and on the hamstring. Now, we have an assisted stretching program that we call Stretch with an N because it has a neurological flavor. And what we've done is come up with really cool protocol to use the art neurological therapy again at the same time that we're doing the stretch. And that makes stretching so much easier. Admit it, you don't like to stretch. I get patients that always ask me, Dr. Arkfeld, what can I do at home? Is there any stretches I can do at home? I know they mean, but I also know they're not going to do them. I can print off sheet after sheet of stretches, hand it to them, and they're not, they may do it for a couple days, but then they're going to throw them away. Come in and do an assisted stretching. Assisted stretching is a lot more fun. You get a better stretch. So, what is assisted stretching with stretching? We do the stretches for you. You sit back and we do the stretches for you. And by the time you get done, you feel great. And we do it again with the art neurological therapy attached. We get much better clinical results with it. So, I need to talk to you about one of my patients, one of my favorite stories. We had a patient that presented a few weeks ago. Her name was Jennifer. And again, it was right before I was going on vacation. I always get bombarded with new patient and acute patient right before I go on vacation. So Jennifer came in, and after doing the history, real thorough examination, I diagnosed her with a disc problem with radiculopathy. The radiculopathy is actually the same thing as sciatica. She had sciatic nerve that was not firing like it should to the muscle, creating muscle weakness. She had sensory changes in her feet, and she had sciatica. She had burning pain going down the back part of her left leg all the way down to the calf. I sent her home with Biowave Go, and then we brought her back in once I got back from vacation, and we got her going on our lumbar traction unit, again, with the Biowave still hooked up, and we put hot packs on the low back. See, the good thing about that is that when you start doing the stretch from the traction, it's going to stretch the muscle. And sometimes those muscles don't like that. And so if we put the Biowave Go on and then we put the heat, it relaxes them. A better scenario is when they get off the table. And I don't know if you've ever been to decompression and you first got off the table and it was really painful. It took you a while to get up and get moving around, then the pain went away. That's typically from a reactive muscle spasm and from gravity coming into play. We take that away by doing therapy at the same time we're doing the mechanical traction. And so she got off the table. We had separated the vertebrae. We had got the pressure off the disc, and the pressure was starting to get off the nerve root. Sciatic nerve was feeling much better. And then we transitioned her in to art neurological therapy, where we put the pads on the low back, and we had her start doing toe touches, 4 sets of 5. And then we gave her a rest. We did 4 sets of 5 again. And we kept increasing the intensity on the art neurological therapy. And so what we're doing is we are jump starting the muscle to get back to their what they should be. We then moved the pads down to her quads, and I did stretches on her quads. And then we moved the pads onto her hamstring, and we do both legs. I don't want to ignore the good leg. We do both legs and we stretch. By the time she gets done, she can touch her toes with no pain. She's doing great. Now she's still in care. And even after I get her released, I'm going to recommend 1 time a month treatments for her where we come in and we're going to put her on traction and we're going to do the art neurological therapy. So what that's going to do, it's going to be her recovery day. And we're going to make sure that those multifidus muscles stay on guard and do what they're supposed to do. And then we're going to take the effects of gravity because we just get beat up with gravity all the time. And so we have found that the 1 time a month really keeps the potential for further disc problems at bay. We've been very successful with that. Now, some patients may need 1 time a week, some need every other week, but we try to get them to 1 time a month. You know what? Here's the thing I want you to come away with this, because sciatica, it sucks. Let's just put it that way. It's just not fun. And it doesn't have to control your life. You don't need to suffer for weeks or months. waiting for relief. You can take control of your own care, and it can start in the comfort of your own home with therapy called Biowave Go, immediate therapy that can go right in there and start to calm that nerve pain. Hey, Biowave Go, first of all, I need to say something. I don't work for Biowave. Some of you may be going, "Okay, you're always mentioning Biowave Go and Art Neuro, and we're going to be talking about other things we use in the clinic like Brain Tap and Normatec." I don't work for these guys. Okay. I believe in these products. I believe that every single chiropractor in this country, if they want to treat chronic pain, if they want to treat disc problems, if they want to treat any kind of neurological dysfunction, they should have Biowave Go. They should have art neurological therapy consisting of the RX 100 unit, which is the clinical unit. And they should have the PRS, which is the home based unit. They should have Normatec and they should have Brain Tap. Take it for what it's worth. That's my opinion. But I'm going to end on this one. And I'm going to end like I do every single episode. All you have to do is lose the pain. And I'll see you in the next episode.